In the run-up to the UK election, we want to use this time to take you through our oral health manifesto point by point. We hope that policymakers take this opportunity to brush up on their oral health knowledge so that they can better equip the country with what it needs. Right now, we're going to be focusing on progressive smoking age legislation. Now, progressive smoking age legislation, the really basic explanation of this is basically, once it's passed, if you are under 18, you won't be able to buy cigarettes. And then the next year, if you're under 19, you won't be able to buy cigarettes. And then so on and so on and so on and so on. Is that right? That's my understanding of it.
It's, well, yeah, I mean, it is something that is a little bit complicated when you kind of read it, but it may be easier to say anyone born after 2009 will not be allowed to buy cigarettes or tobacco. So
it's a much easier way of saying that.
Yeah, possibly.
Ignore everything I've just said.
Yeah, I mean, that's probably the best way. So, you got a child that's born in 2010, they'll never be able to legally buy cigarettes or tobacco. So that will obviously reduce the number of younger people being able to pick up the smoking habit. I mean, smoking leads to more than 500,000 hospital admissions per year and 75,000 deaths in the UK per year is caused by smoking. Now, that is such a huge number of sad occurrences by something that is often seen to be or used to be seen as a social habit. Obviously, then when we realized quite how dangerous it was, many people were so addicted to it that they've been really unable to stop. So ideally, we would like to prevent anybody from beginning to smoke and helping people who do currently smoke to give up.
It's one of those things, like, tobacco products come and go out of fashion, and so there's always going to be alternatives. We won't talk about vaping at this juncture, but that's also a big concern. But the tobacco products themselves, we know, are linked to cancers, and mouth cancers, mouth cancer is an issue that's very close to our hearts. We've met so many people that have been affected and seen the impact that it has on people, and so anything to lower that risk and save that heartache of what people have to go through with this treatment and this condition is something that we couldn't not put on this list, really, is it?
Totally. I mean, obviously we see it from an oral cancer point of view. We know that smoking causes many other cancers and many other serious health issues. There used to be many people that didn't even realize it caused mouth cancer. We've heard of lung cancers. That tends to be the one that people immediately think of with smoking. But you're talking about things like COPD and emphysema and lots of different breathing problems, but also problems with your teeth and gums as well, because the smoking actually closes the capillaries that are in your blood, so your gums don't bleed if you've got gum disease, so it can mask the problem. So if you, for example, were brushing your teeth and they were regularly bleeding, you would probably go to your dentist and say, I don't think this is quite right. My gums are bleeding quite often. If you smoke, you often don't get that warning sign. So the gum disease can be quite progressed by the time you do actually go and seek help for it. So there are lots of different things. The staining that smoking causes is really horrible. It's very unsightly, and most smokers want to have that polished off, and I wouldn't say to anybody it's easy to give up. It's not easy giving up a habit, but for the health of yourself, your family with passive smoking, over the years there have been many different sort of legislation coming in, like smoking in cars with young children. Smoking indoors was a massive one those years back.
Huge, the uproar that caused as well. And now
Absolutely.
looking back, I can't imagine why we ever thought that smoking inside was a good idea, especially around food.
I
And
know.
like, why did we ever do that?
And it's kind of like hits you in the face when you go abroad and people are still
Absolutely.
smoking. So this legislation we fully support. It's a good way of bringing something in gradually. It's a good way of not saying, right, this is a ban that's just going to be, from now on, you can't ever buy these. So we're looking at that age. People born after 2009 will never have been able to buy them legally. So it will slowly bring the age down or up, down, so that there are less people that have that can easily get hold of cigarettes and tobacco. I mean,
Yeah.
they're not hugely easy to get hold of now. I mean, they're behind a screen. You have to
You've got to
physically go and
ask
ask for
them.
them.
Yeah, they've
You've
changed the
obviously got to
branding and
prove,
yeah.
which is all to the good. But I think this one will be the one that almost saves our next generation. And obviously the government's aim, the country's aim as well, is to be smoke-free by 2030.
Mhm.
And this will go some ways to
Go hand
helping
in hand
this.
with that. Yeah.
Yeah,
And I know
absolutely.
one of the things I've sort of heard in opposition to this legislation is, well, in 60 years' time, that's going to be absolutely ridiculous because you're going to have a however old, like say a 60-year-old and a 61-year-old that one can buy cigarettes and one can't. But actually, tobacco products, like I say, they fall in and out of fashion, and no one goes out and buys tobacco for a pipe anymore, really. That was a big
Mm,
thing at one
mm,
point, but now less and less.
mm,
Same with cigars. That used to be a big thing, like a
mm,
celebratory cigar and whatnot. And now we've kind of moved past that. In
mm.
God knows how many decades and generations, we're probably going to look at smoking the same way and say, oh
Yeah.
God.
The
And
way I look at it
yeah,
is that 60-year-old will never have bought tobacco. So why would they be jealous of the 61-year-old that could go out and buy a cigarette? Because if this works, and we hope it does, they will never have bought, they will have never have got the habit. So it won't make a jot of difference to them whether, somebody who's a little bit older can actually go and legally buy them. We would hope by then, and when we're talking sort of, 50 odd years into the future, we would hope by then that we are a smoke-free country.
read the full manifesto on our website and get in touch with your local councillor to see what they're planning to do to improve the oral health in your area. Next time, we're going to be looking at ring fencing funding for education.